The following episode is brought to you by the American Urological Association. This episode is part of a special series highlighting the AUA Update Series Volume 45. In this episode, we will be covering some of the key lesson points with Dr. Jake Fantus, one of the authors of Lesson 11, At-Home Diagnostic and Therapeutic Options in Men's Health. Now in its 45th installment, the AUA Update Series is renowned for delivering high-quality lessons to practicing urologists, fellows, and residents. All content is developed by internationally recognized experts in urology, making the AUA Update Series the most professional and sought-after self-study program available. Improve your practice and patient care by staying abreast of the latest treatments and surgical techniques in urology. For more information or to subscribe to the AUA Update Series, please visit the AUA University.
Welcome to another episode of the AUA University podcast. I'm Dr. Mark Gonzalgo, Professor of Urology at the University of Miami and Chair of the AUA Office of Education. Today we're tackling a topic that is reshaping how patients engage with their own health and how we as clinicians need to adapt to meet them where they are. At-home diagnostic and therapeutic options in men's health. This is lesson 11 in our update series, and it addresses something that is happening right now in your patients' lives, whether or not they've told you about it. The direct-to-consumer telemedicine and home diagnostic space has exploded in recent years, and as a urologist, we need to understand what our patients have access to, what the evidence says, and how to have informed conversations about these tools in clinic. Joining me today is Dr. Jake Fantus, Associate Professor in the Department of Urology at the University of Kansas Medical Center, where he also serves as a physician informaticist. He completed his residency at the University of Chicago, followed by a fellowship in infertility, andrology, and sexual medicine at Northwestern University. His clinical practice and research focus is on male reproductive medicine and clinical informatics. Dr. Fantus, welcome. It's a pleasure to have you with us today.
Thank you for those kind words. It's great to be here.
Let's start by helping our listeners understand how to get the most out of this update series lesson. What's the overall structure and how would you recommend approaching the content?
Well, the overall structure is taking several different at-home diagnostic and therapeutic tests that are common to urologists and how they're presented to patients, ranging from at-home cancer diagnoses, hormone evaluations, fertility evaluations, and even sexually transmitted infection evaluations. Talks about kind of the up-and-coming tests, the validity of each test, and then the perils and pitfalls on an individual basis. At the very end, there's a synthesis of information of why there are some major potential benefits to patients, but also things that will help clinicians understand how to best integrate these things into their own practices and what to watch out for.
Yeah, it's great. I think that, part of the framing, I think, for this lesson is also important because we know that a lot of patients are often several steps ahead of us in terms of what they've already researched, right, or tried. And being prepared for those conversations, I think, goes hand in hand with trying to deliver the best care possible. Can you explain perhaps what makes this the right moment to include this type of topic in the update series?
Yeah, I mean, ever since the direct-to-consumer advertising of pharmaceuticals in the 90s, there's been an explosion. And even in the pre-pandemic era, we were seeing an increase in the number of direct-to-consumer platforms, whether they be for men's health or other issues. So it's timely in the sense that there's been increased virtual prescriptions to patients. But as soon as COVID happened and telehealth really became even more prominent and then recently extended to the end of 2027, this is a time that is ripe for patients either being marketed medications or services and or having telehealth appointments with other providers of varying specialties. So really, I think it's timely in the fact that there are a lot more of our patients that are currently being advertised these services.
And I think, I'm curious to get your thoughts on two things about this because there oftentimes are layers involved when patients come with different pieces of information. I guess the first is clinical accuracy, right? How reliable are some of these tests? I mean, when a patient brings in a result, for example, maybe an at-home testosterone kit or a fertility panel, How should they kind of interpret that in the context of what we as urologists do? That's kind of the first question. And the second question, I guess, is on patient safety, right? Because when patients self-diagnose, and then many of them may even self-treat based on those results, I think this could also be of concern.
Yeah, I mean, this lesson is really designed to tackle both of those issues. A very high level overview, we go over several of these different at home tests, as well as mail in tests in terms of the accuracy of different ones. It's not completely comprehensive, as there are hundreds of different tests, even for testosterone, that are offered to patients directly. But it does give a broad overview of kind of what to be on the lookout for in terms of which type of test may be more accurate from a diagnostic standpoint. Some are certainly have similar accuracy to our gold standards. Others have some problems, and I think what you've kind of alluded to is the self-diagnosis of this, where patients may misinterpret data. Again, most of us are board certified and spend a lot of time training to interpret these data. One pitfall we address without giving too much away is, at-home PSA testing looks very different for somebody who has prostate cancer, is on active surveillance, has had a prostatectomy. The reference ranges and things coming from the lab may not necessarily reflect the patient's history. So that's just a tiny teaser of one of the things that clearly gets to patients from a safety standpoint. I think the other part of the safety in general, though, is when we look at what these tests offer, the question should always be in the back of our minds: what are we missing? What do we offer as clinicians that these direct-to-consumer platforms don't necessarily offer? And again, the lesson will explore all of these different facets in greater detail with specificity to whatever test we discuss.
I think it's important also to have a balanced approach when dealing with patients. It's not about dismissing what they're using, but I think maybe increasing our awareness so that we're able to engage with them in a thoughtful way. And I'd encourage our listeners to go into the lesson with that same open and analytical mindset. Also included in this particular update is a table summarizing the key at-home tests in the men's health space. Can you give our listeners a high-level sense of what's covered?
Yeah, the table is being referred to specifically as a fertility testing table, looking at a lot of the different fertility tests on the market, thinking about trying to navigate the privacy of fertility testing as well as the accuracy of fertility testing. The traditional semen analysis having to be produced either in a laboratory setting or somewhere close to when they're being brought in obviously has some psychological potential consequences for a male. And for that reason, these tests that exist at home or send in, can be largely beneficial. The lesson and the table really go into, the cost, the efficacy, the utility, the accuracy of the tests, and who these tests apply to.
The table is probably one of the most practical elements of the lesson. I think, with the emergence of new products that is constant, sometimes the evidence base is still catching up. And the table, I think, gives a great snapshot of where things are today. And the lesson actually also gives you a bit more information about the framework for evaluating new tools as they emerge. And I think that framework concept is valuable, since you can't really memorize every product, right? But if you have a systematic way to evaluate the validity of a test, that it can be very helpful. And I think it's that kind of thinking that we hope to cultivate in this particular lesson. So I want to shift now to the patient experience side of this. Okay, what does the evidence say about patient satisfaction when it comes to these, diagnostic test kits or at-home options, and where do you see this heading?
Yeah, I mean, you had mentioned this briefly previously, that this is not going away, and that it is something as urologists we all have to be aware of and how it integrates our own practice. And I think patient satisfaction is a big reason why. There's several points here. There's a convenience aspect. Outside of the men's health space, things being offered more conveniently to a patient at home rather than going in or going somewhere are obviously going to be appealing. There's an aspect that a lot of the conditions that we treat are sensitive in nature, especially in men's health when we talk about testosterone levels that may be associated with sexual symptoms. Again, fertility treatment is obviously very sensitive. Sexually transmitted infection testing can also be very sensitive. And for that reason, being able to order something or do something in the convenience and the privacy of your own home has been shown that patients are very satisfied doing that rather than picking up a medication, a prescription, or a test, at a pharmacy or a hospital. And then beyond that, there's an access issue. I mean, we could talk about the access of how few urologists we have, per capita, but specifically in the men's health space and specifically in the infertility space, there's even larger amounts of deficits. And there's also large geographic swaths of areas that are not covered by said specialists. So again, just having the access to some of these tests and potentially through telehealth to some of these services is immensely important for patient access and satisfaction.
As we know, patient satisfaction with these tools tends to be high, and that shouldn't be a surprise to us. And men in particular are a population that has historically been underserved by traditional healthcare, utilization patterns. So if an at-home test gets a man to engage with his health who otherwise wouldn't, I think that is genuinely meaningful. Now, looking ahead, I also think we're going to see increasing integration of at-home data into the clinical encounter because the increased use of things such as the wearable devices, right, home-based testing and patient-reported outcomes are all going to become increasingly important for how we monitor and manage our patients longitudinally. So we're coming up to our closing, and I want to get some final thoughts from you, Jake, to make the case for our listeners. Why is this particular update series a must-read?
You really hit the nail on the head when you said that this series is really designed to give you a framework to understand the current landscape and how to integrate with the future landscape of direct-to-consumer and telehealth within the men's health realm. It is something that, as I said, is not going away and that we need to be familiar with and work with and be able to critically appraise these different platforms to ensure the best care for our patients. It's important to understand what services are in general offered and where pitfalls may arise and where we can integrate ourselves and be useful to improve the patient experience, but also improve their overall care.
I think that's a compelling call to action. I couldn't agree more. Dr. Fantus, thank you so much for joining us today. Your expertise in men's health and your ability to synthesize this information into something that we can all understand is very much appreciated. I think this particular lesson will definitely provide greater insight that we can utilize when dealing with our patients. And to our listeners, thank you for tuning in to today's episode of the AUA University podcast. I'd encourage you to take a look at the lesson 11 in the update series and see how it might be able to help you with your own patient experience. The field of men's health is evolving quickly, and staying current is one of the most important things that I think we can do for our patients. For more educational content, visit auanet.org/university. I'm Dr. Mark Gonzalgo, and on behalf of the AUA Office of Education, thank you for your dedication to advancing your knowledge and delivering outstanding urologic care. Until next time.